Reflex somatotopic systems behave as bio-holographic phenomena, with each cell containing information about the whole organism. This view reflects ancient Chinese beliefs that the human is a microcosm, expressing harmony of a natural order within the overall universe. Welcome to On the Pulse, where we take a deep dive into the integrative solutions in the field of medicine. I'm your host, Dr. Amber. Hi everyone, welcome back. In today's episode, we're going to take a look at auricular acupuncture. We're going to spend some time understanding how the auricular acupuncture ear map came about and why specific points are located where they are. And we'll take a look at the big picture of how auricular acupuncture treatments work. Auricular acupuncture is a method for diagnosing and treating physical and psycho-emotional dysfunctions by stimulating specific points in the ear. Auricular acupuncture has been employed for approximately 2,500 years, for which the oldest record is the Huangdi Neijing, the Yellow Emperor's classic of internal medicine. In classical TCM or traditional Chinese medicine literature, there are many references to stimulating specific points on the ear with needles, moxibustion, and massage to prevent and treat disease. Citations of treatments using points on the ear are also found in Egyptian tomb paintings and in ancient Persian medical references. And then a report by Hippocrates is actually the oldest record from the Western world. More recently, in France, in the early 1950s, Paul Nogier systematically mapped the auricular to body correspondences. His teachings spread from France to Germany, Japan, and then finally back to China, where his charts were screened, verified, and refined in clinical practice. Nogier's theory for the spatial arrangement found on the external ear was based primarily on the proposition that there are neurophysiological connections between auricular reflex points and the central nervous system. The somatotopic pattern said to exist in the external ear is configured in a manner similar to the neurological homunculus of the human cerebral cortex. This is the idea of mapping the body onto the ear and remains an area of future neuroscientific research. In 1957, the international scientific community became aware of the map of the ear and that it resembles an inverted fetus. This introduction has led to auricular acupuncture becoming a more systematic approach with standardized points. More precise information about the specificity of ear acupuncture points is now available with studies from 2014 and 2015 that used functional magnetic resonance imaging, or fMRI, to measure brain activity during ear acupuncture. For example, Gao et al. In 2008 proposed that stimulating different points in the ear can modulate the cardiovascular and gastrointestinal systems. Alamy et al. 2002 demonstrated that acupuncture in the ear point corresponding to the hand leads to fMRI changes in the somatosensory cortex for the hand. Ramoli et al. 2014 employed fMRI to detect the differences between two stimulated acupoints. So first they stimulated the thumb auricular acupoint, so the point on the ear that corresponds to the thumb, and this led to corresponding changes bilaterally in the primary somatosensory cortex and the second somatosensory cortex. However, when the brainstem auricular acupoint, so the point on the ear that corresponds to the brainstem, was stimulated, this showed changes in the fMRI in the limbic and cortical areas of the brain. So this highlights, this last study highlights that precise point selection in the ear is indeed important, and that specific ear points do correspond to different body points, and that they can produce significant changes in the brain. So auricular acupuncture can be used for treatment, but also diagnosis. And what's interesting is that when internal disorders occur, changes such as tenderness, decreased cutaneous electrical resistance, and even morphologic changes or discoloration can appear at specific ear points. So we commonly see these changes in clinical practice and often surprise our patients by asking them about their chronic neck pain or even menstrual cramps that they had perhaps neglected to mention by simply observing the ear. In a blinded study made by Ramali et al. On 506 patients, clinicians actually achieved a 78.6% success rate at identifying symptoms and syndromes related to somatic and mental disorders using ear diagnosis. So they used three different methods: visual inspection of the auricle, so visually inspecting the ear, a pain pressure test, and then electrical skin resistant tests on different points of the ear to then diagnose different internal conditions. So another theory that supports using ear diagnostic procedures is called delta reflex theory, and it posits that cold or heat stimulation on parts of the body raises the temperature in the corresponding parts of the ear from 1 degree all the way to 5.5 degrees. And it was Dr. Cho who proposed this theory in the 1970s. And it's believed that this reflex, this delta reflex theory, that this reflex might be influenced in part, at least, by the vagal nerve. So these different studies support the ongoing discussion of auricular therapy as a reflex somatotopic microsystem. Many such systems have been described in the human body and range from the very simple to quite complex. In TCM, 4 primary somatotopic microsystems involve the tongue, the radial pulse, the face, and the ear. The first 2 are used for diagnostic purposes. Theorists have speculated that reflex somatotopic systems behave as bio-holographic phenomena, with each cell containing information about the whole organism. This view reflects ancient Chinese beliefs that the human is a microcosm, expressing harmony of a natural order within the overall universe. So we took a look at how this map of the ear is used for diagnostic purposes, and let's go a little further into the mechanisms that underlie the reasoning for how the different points are organized on the ear. So there's 2 primary organizational models, and the first one is that somatotopic organization that we mentioned previously. This involves mapping an inverted fetus onto the ear with the head corresponding to the earlobe, low back, lower limbs, mapping onto the top part of the ear, if you can imagine that. And then the other model is actually using embryological regions. According to Kesa Lengren in the book EAR Acupuncture, published in 2008, the embryological hypothesis has 2 main parts. First, the model is based on the development of the ear in the fetus and the adult ear's nerve network. The second model is using embryonic tissue correspondence. So you may remember from your anatomy and physiology classes that organs and tissue develop from the fetus's 3 germ layers: the endoderm, ectoderm, and mesoderm. These germ layers then become specialized into different organ systems. Paul Nogier maintained that each tissue type in the ear had a link to the various somatotopic reflections and to the innervation related to that part of the ear. So the ear is innervated to a large degree by 3 nerves. In the zones innervated by each of these nerves, there are differing distances between the receptors, as is the case concerning the different parts of the body innervated by those 3 nerves. The more primitive internal organs have the least number of receptors. There's several receptors in the more developed musculoskeletal tissue and most in the central nervous system. Let's take a look further at the endoderm. So the endoderm gives rise to most of the internal organs except for the heart and kidneys, which for practitioners of Chinese medicine, we know that there's this Shaoyin axis link between the heart and kidneys. So the endoderm gives rise to the stomach, the intestinal system, the lungs, tonsils, liver, pancreas, bladder, urinary system, thyroid, parathyroid, and thymus. The organs are represented in the concha part of the ear, which is innervated by the vagus nerve. Moving on to the ectoderm gives rise to the skin, the brain, spinal cord, subcortex, cortex, peripheral nerves, pineal gland, pituitary gland, all the way to membrane of the nose and lenses of the eye. So the part of the ear where these organs are found is served by a branch of the plexus cervicalis, which has indirect connections with the cortex. And the ear, the organs are represented on the lobe and the tail of the helix. Moving on to the mesoderm. The mesoderm gives rise to the skeletal muscles, the smooth muscle, blood vessels, bone, cartilage, joints, connective tissue, endocrine glands, heart muscle, uterus, fallopian tube, testicles. And part of the ear where these organs are represented is served by the trigeminal nerve, which supplies the brainstem with pain-blocking impulses from the muscles and skeleton. The organs are found represented in the antihelix, the scapha, and the fossa triangularis. So now that we took a look at how the ear mapping system works, let's go a little deeper into how the auricular acupuncture treatment actually works. In his text, Acupuncture Energetics, a clinical approach for physicians, Joseph Helms implicates afferent nerve stimulation arriving at a modulating center in the brain, which may trigger efferent impulses that change the sensitivity of the skin on surface reflex zones. So this modulating center in the brain might be a reticular formation in the brainstem. And this area in the brainstem may function as a modulating unit, which activates and inhibits neurologic impulses that travel through the spine, through the viscera. And basically this particular unit in the brainstem may respond to input by patterning topographic regions of the body. This means that this particular unit may have a role in this body mapping system that's so prevalent in Chinese medicine and that we use in auricular acupuncture. So this area in the brainstem may activate other areas that are involved in pain modulation. And it does this likely through the autonomic nervous system. So we're going to have to land this plane for today, but we'll come back and talk a little bit more about specific applications of auricular acupuncture. Suffice to say that auricular therapy has been applied for pain relief, the treatment of epilepsy, anxiety, and obesity, and for improving sleep quality. I particularly like using auricular acupuncture to treat conditions such as addiction, chronic allergies, skin disorders, and disorders involving the neuroendocrine system. The ear is like this smart device that allows the practitioner to remotely access the whole operating system and create profound changes.